Hi, everybody. Welcome to Special Education Thursday, and welcome back. We're actually doing one on Thursday this time, which is pretty exciting. I am Molly Whalen, and I am do Special Education Thursdays on behalf of Advocates for Justice in Education. AJE is the official parent training and information center for special education and disability issues in DC, and they support parents and youth in navigating through this system. And about 2 years ago, we created Special Education Thursdays to take a little bite-sized piece out of something within special education or disability issues in DC and try to explain it a little more. And we've been able to talk with lots of experts throughout the city. And today we're taking one that you may not think of right away when you think of special education, but if you have a youth with a disability, it's a really big topic that all parents should be thinking about at some point, if not early, definitely when your student or child is at transition age or in high school and looking about the future. So we're going to talk about understanding medical and healthcare transition for youth and young adults. And I've got the wonderful Dan Beck and Samita Alongo from the National Alliance to Advance Adolescent Health, and specifically with the GOT Transition Project. So Dan and Samita, welcome.
Hi.
Thank you.
I'd love for you guys to each introduce yourself and just tell a little bit about what you do and how you got to do that here in our city.
So my name is Dan Beck. I'm the Communications Director for the National Alliance to Advance Adolescent Health and GOT Transition. We're a small nonprofit organization, and we have funding from both the federal and the DC governments to do this healthcare transition work in DC. So I started working for the National Alliance, just looking at kind of some of the statistics about transition, which we're going to talk a lot about. And then we started working locally with local practices and families to improve this transition from pediatric to adult care and from childhood to adulthood in terms of someone's health and their health care services. So I started doing this about 8-9 years ago, and it's really been exciting to see a lot of gains in DC around this topic.
And I am Samita Alongo. I'm a health research and policy analyst here at the National Alliance and GOT Transition. I am newer to the team, and my 2-year anniversary is in June, so that's coming up. And I wear a few different hats here. I help work on the research side, so reading, writing, and understanding the current landscape with healthcare transition, both nationally and locally. But I also work on different quality improvement projects that are happening local in DC, and that can be happening at some of the public high schools here in their school-based health centers, and also at federally qualified health centers here, such as Mary's Center. So every day is different here, but it's a lot of fun, and this topic is, I think it's gaining more and more importance as the months and years go on, and I think that's a really awesome thing to see.
And so when we're talking about, so a lot of students with disabilities, as we've talked about on our webcast before, have an IEP, an individual education program as they go through education. I think a lot of parents, unless they have a student with special healthcare needs, may not realize how the medical and healthcare transition is kind of part of special education in the broader sense. Can you guys talk a little bit about, what healthcare transition is and what you're thinking about?
Right. So this is a topic that obviously relates to pretty much all young adults who are aging into the adult period of their life, but it takes a lot of importance for young adults with special needs, with chronic conditions, and other things like that. So, the statistics are, there's a massive amount of these 12 to 26-year-old people in the country And we know that about a quarter to a third of them have chronic conditions. So the real idea of healthcare transition is both to empower young adults and to help them, to the best of their abilities, manage their own health, while also transitioning typically from the pediatric to adult providers in the healthcare system. So it's kind of a two-pronged approach. And, we understand that for all families, for all young adults, it's different based on their disabilities, based on sometimes their desire to transition, to tell mom or dad to get out of a meeting with the providers, that this transition looks different for pretty much every young adult who's transitioning into adult care.
Mm-hmm. And I think I'd just like to jump in and say that often some people talk about it as medical transition, but I think something that we're trying to do is describe it as healthcare transition, because it can encompass both medical conditions, but also health conditions, mental health conditions. So behavioral health, mental health, medical health, I think it's all related. So we just try to put it under the healthcare transition umbrella term.
Okay, so let's go on to your, for those of you who are watching on screen, they've got a really great, I think, chart about the 6 core elements approach for transitioning to adult care. So it actually starts at age 12. So I'd love for you guys to talk about why kind of starting at pretty young age, like what's the point of that?
Well, so as with a lot of other transitions in a young adult's life, whether it's their employment, their moving on to maybe living on their own one day, youth and young adults need to know from an early age that they're going to have to start to take on some of the responsibilities of their own health care. And it's in our view and from our experience, the earlier that a young adult starts to think about those things, the more effective and more smoothly they're going to transition.
Yeah, it's less daunting.
Yeah, it's less daunting if you start telling a 13-year-old, hey, one day you might need to call your own doctor's appointments or fill your own prescriptions. It's something that then when at 18, when they are doing that themselves, it's a lot easier for them to make that move. So as part of the Gut Transition project, we have a thing called the 6 core elements here, and it's really an approach to transition that is both from the provider side and from the family and the youth side, something that ensures more of a smooth transition to adult care. So knowing that there's a policy in place at your provider. For number 3, checking in to see your readiness for your transition. We have some great readiness assessments that we're going to talk about later where young adults and their family members can fill out the form that says different aspects of their health and their health care, and they just say, yes, I know how to do this, or no, I don't know how to do this. It kind of assesses how ready they are to be making those moves. And then with kind of any situation, it's always important to have a plan in place, to have clear goals, to make sure you have all those important medical summaries and things like that. And then eventually, this is something that most young adults are doing. They're transferring on to an adult provider. Most pediatricians don't want to be seeing young adults who are turning into their 30s. And again, there's differences in subspecialists and specialty care and all that. So this is just our approach to it, and there's tons more on Got Transition's site about all these different elements.
And Molly, I'm sure you know, but we always try to impress to families and healthcare providers that the healthcare transition isn't just one moment in time where you're transferring from one side to the other. It is that process over the years from, we say, 12 to 26. So it's definitely like an ongoing thing.
And so can you guys put a little, give me a couple of real examples? I think it's always helpful for parents when they see charts like this, it makes sense, but then you think, like, what's the real world example? Can you give me a real world example of a child with any kind of chronic condition maybe you're thinking of, how this might look?
Sure. So I can give an example, maybe something related to our behavioral health pilot project, which we're doing at Mary Center. So we have these tools. They're the GOT Transition 6 Core Element tools. And when we approach a practice that wants to incorporate the tools into their system, the providers get together with our staff and we pick out which elements would be most useful in their practice. So in the behavioral health space, we thought, okay, because these were going to be done with seniors in high school, we looked at our readiness assessment and we customized it to the questions related more to their behavioral health. And these were kids that were receiving ongoing care for some more severe behavioral health conditions. And we sit down, we customize the tools, and we also did things like a post-graduation wellness plan that talks about, we customized our medical summary but made it more behavioral health, so it's what to do in case of a behavioral health crisis. It's also, it also outlines my plan of what to do after I leave school and what adult mental health or behavioral health provider I'll be contacting afterward. And we customize these tools, and then we test it out with some of the students. And we say, are there any words you don't know? Are there any concepts you don't understand here? And we try to bring down the reading level and the concepts, so these are all student or youth-friendly. And then what happens is they get implemented into the school or health center as a pilot, and usually the pilot will last minimally a year, or it could be up to 2 years or 3 years. And every month we meet and we talk about how this is going, and the student and the providers will always tell us, like, oh, our students liked this, our students didn't like this, they thought this took up way too much time. And at the first meeting, usually with the provider and the young adult, they'll do a readiness assessment to understand the baseline of how ready the youth is to transition. And this will happen, well, in this example, this happens at the first meeting in their senior year of high school, but this could also happen earlier. And then at the end of the pilot, we have them do another readiness assessment, so it's about a year later, and we see if there's any progress. And throughout the year, we're working on the gaps that they didn't know on their baseline assessment. And we go forward and work on those, and then at the end of the year, we see, improvement, and we try, if there are still remaining gaps, the provider tries to include those in the summary that they're then going to transfer to the adult side. And we either give the student, the medical summary or behavioral health summary, and we say, bring this to your first adult appointment, and then also the behavioral health provider will email or send the summary to the adult side, so everyone's informed as much as possible. And this also comes with appointment reminders and little things along the way that can assist the youth in making that transition.
Yeah, and I guess what I was asking was, because most of the people listening to this are parents, like, what does this look like to a parent? Like, if you had, let's say you have a child with asthma, what would discussing transition policy and doing transition tracking, what would that look like to a parent with asthma? Is it just talking about, hey, these are the kinds of medicines that you take with your asthma, or this is, thinking about what kind of environment you need to do? So that's what I was looking like for a specific.
Sure, sorry.
Sure. So, Molly, actually, if you, for the people watching, if you skip ahead 2 slides, so I had mentioned this before, the Transition Readiness Assessment is a great tool. So this one is for youth with intellectual and developmental disabilities. There's also one for parents of youth with intellectual and developmental disabilities. We just have other transition readiness assessments on our site, and then there are also some that are specific that we've worked with other organizations. So there are some for, specifically with questions for youth with diabetes, with, other kinds of conditions like that. So these are great tools for a parent to fill out. Our tools will say at the top for parents and caregivers or for the youth, and it's a way for them to see what they know that their child can do and what they know that their child can't do. It's also sometimes when you look at one parent caregiver readiness assessment and have them fill it out, and if the young adult is able to, they can fill out their own readiness assessment, and sometimes it's a great opportunity for the parent and the young adult to compare. There are often times we've seen where these readiness assessments, a young adult will say, yes, I know how to do this, and the parent will say, no, they don't know how to do this, and then when they come together afterwards and meet, a parent will say, well, do you know how to do that? And the kid will say, yeah, I know. Or, I know how to describe my condition to someone. I know my doctor's name. I know my prescription, medication names are so long and cumbersome. Sometimes we forget that our, young adults are actually listening when they're sitting there. So the readiness assessment, I think, is a great tool for parents and their young adults to fill out, to really go over, and then from there to really think of what are the things here that we can work on.
Mm-hmm.
Sometimes
I just want to some of them so that if parents are listening and not watching, like knowing, a student knowing what their medical need is, knowing what medicines they take, what the names of them are, not just, I take the red pill and the green pill.
Sure.
About, how a doctor's appointment is made. So
Mm-hmm.
Would you have any advice to parents if they have a student or a child with a chronic health condition? Are there little things that they can start doing in that, 12 to 18 range? Do you recommend them, having the doctor talk to the student as opposed to the parent? Do you suggest a parent, help them write down the names of their medicines? Because I think what's so hard is you mentioned it earlier, is that a lot of parents take control over this, and then you can't just turn it over to the child okay, tomorrow you're going to be in charge of this. How do you kind of ease in the awareness of all the, kind of the where's your prescriptions, who's your doctor,
Right.
Sure.
What you need to do?
One thing that we always advocate for is the importance of alone time during a doctor's appointment, and that can happen slowly at first, the last 5 minutes of the appointment, the parent or guardian will leave the room and the provider has some alone time with the youth, and then slowly build up to having it being more and more time with just the youth and the provider. Another option that we always talk about is having the youth and the parent together put in the youth's medical information into their cell phone. Often most smartphones these days come with a health app where you can type in your condition, your allergies, medical emergency information, so if you have a doctor or a parent on call. And doing that together, I think, one, you see it happening as a young adult, but also the parent knows that they have that information. And often these apps, they're accessible by the emergency crew if something does happen to the youth. The apps are actually accessible on the phone without having to go and unlock the phone. They're accessible outside of the lock screen. So I think that's really good. And also maybe having the youth trying to fill out that information on their own at first, and then if they need help, obviously their parents can help.
Do you have any, that sounds like a great tool. Do you have any specific apps that are, ones that you've recommended or people can search for?
Yeah, so the medical ID, if parents want to search for that, if you go to gottransition.org and search for medical ID, we have a whole document about putting that on your phone. I mean, there are tons of apps out there, but that one is actually in the health app
of the iPhone.
And there's also an option for the medical ID. It's a free app for Androids out there too. So yeah, the medical ID is definitely a big one that we, not just young adults. I mean, I think I'm forced my mom to put her information because God forbid one day she's out walking and she faints or something, is on the side of the road. on the emergency screen of anyone's phone, you can click medical ID and it'll show up, what her...
Yeah, and if you have an iPhone, it's that app with the white square and the pink heart.
Yeah.
Right. And then that way, and you're saying that a lot of emergency personnel know to look for that on a... Oh, really? Okay, great.
Mm-hmm. Yeah. The using the phone is obviously big for young adults. Parents, I'm sure, know how important the phones are. Another thing, like Samantha said, really having alone time is key. I know we put on the last slide, but if you go to the Got Transition and type in questions to ask your doctor or questions to ask your child's doctor, that tool has a list of questions that are really great. Some of them just include, when does my child need to learn to get ready for adult care? Can I work with you to make a medical summary and emergency care plan? There's questions about guardianship that you should be asking your provider. There's questions of being upfront to talk to a pediatrician. When does my child need to leave your practice? Some practices will keep young adults well into their 20s. Some have hard dates, right? When you turn 21, you have to leave our practice. So we want to ensure that at that point, it's not falling off a cliff, that they have somewhere to go afterwards. And for parents, we always encourage them, ask your doctor, when your child's in that 15, 16, 17-year range, it's getting closer to turning 18, when a lot changes for a young adult in terms of their their guardianship and confidentiality and everything.
And I know for parents,
supported decision making, which we use now in DC, for that as well, or?
Say it again, Molly. Sorry.
Just because we have supported decision making guidelines and agreements now for people with intellectual disability and developmental disability. Do you talk about that with having us use it? A child who's turning 18, they can use a supported decision making agreement with the doctor so that their parents can be part of that?
We just pretty much encourage. We know that a lot changes at 18, so we encourage that conversation to happen. So we usually just tell the parents, you should seek, other organizations who do supported decision making strictly.
We don't have.
We have some tools, but it's mostly just having that conversation. There are other organizations who do that far better than we. So.
Well, I'm going to add in there because I know who they are. If you do have questions about that, you can go to Quality Trust for individuals with disabilities in DC, and they do a lot of work around that. And I have to say, having, everybody who listens to webcasts know I talk about my own kids here. I have a, 19-year-old with autism, and we've done a supported decision-making agreement with his doctors, and actually he just had to have a medical procedure and sent the supporting decision-making agreement to the hospital and the nurses because he was going under anesthesia, and it worked out great. So I highly recommend that as an option.
Yeah, we always send people to Quality Trust. That's one of our go-to resources.
With that. So let me ask you this. So I'm going to try to, as I told you, we've never done a link on here. So I'm going to try to link to the questions, and let's see if, it's not going to let me go. So if you go to, when you listen to this or watch this, you should be able to link on this, and we'll be able to get that. At the very least, you can go to the gottransition.org website, everybody, and get those resources. Would you guys talk a little bit more? Is there any more to say about the other two links that you had about the transition readiness assessment? No,
It's like we said before. It's really just a link for youth and young adults with intellectual and developmental disabilities. But we have just other readiness assessments available. If you go to our site, it's pretty clear where they are. We have a list of resources on our site. There's also a youth and family page, and you can find all these tools there. They're really just great tools to use for youth and for parents. One of many. Our youth and family page has FAQs, so there's probably a question in there that you have. So gottransition.org has tons of the answers.
So let me. Go ahead.
I was just.
Oh, that's the problem with doing webinars. I always like to ask, like, if somebody's really interested in this, one of the questions I love to ask is, you know, I've always gone to, my whole life as a parent, you go to these sessions on special ed and disability, and then they give you a bibliography of like 20, you know, things to go and read. So I always like to hone it down and ask the speakers, like, if there was like 2 places you want somebody to go to find more information, or read a book, or 2 tips that you want to give, what would you each say to that? Like, where to go next?
So I will say that if you are interested in this healthcare transition, I mean, gottransition.org is the national center on healthcare transition. So if you're a parent, if you're a family member and you're interested in this, honestly, go to gottransition.org, and there's clear as day on the front page, a youth and families page that's pretty much any tool that you would need. A lot of these tools are there. The FAQs are really helpful. So there's probably a question there that you have, and we have real stories from parents and young adults answering those questions right on that page. So that's mine, is that page. I don't know if Samita has another.
I guess if you're a parent and want to know some evidence-based research on this work, Healthcare Transition has a good amount of literature from academic journals. And so if you do want to go into that space, it's a little technical, but there are articles about outcome evidence, about the healthcare transition process, and things like that.
Some of which, you know, were done in D.C., so that would be interesting to see how D.C. is doing on this, really kind of leading the charge on healthcare transition nationally.
I guess I mean, this is something that I believe, and I'd love to hear your thoughts on it since we have a few minutes, that this is so important because parents need to learn that, you know, they're not always going to be there. They can't always control their child and their young adults' health. And it's really important for self-advocacy for a child or a youth to be able to take control of their own health. And I'm assuming there's been studies, because it makes sense, that more youth that are in control of their health care and medical care probably do better because they're making their own decisions.
Exactly, and I think we often make sure we get the point across that to have a job or to have a post-secondary education opportunity and to live independently, you have to be healthy to do all those things. And so that should be kind of something always talked about, always integrated into whatever next step a youth is trying to make.
Mm-hmm. And I think
you can't get to class, you can't get to your job, or you can't do a lot if you're constantly, you know, in the ER or you know, not taking care of yourself. So it's something that young adults are always excited about, the next step, where they're going to be going, what they're going to be doing. But unless you're healthy, a lot of those things aren't gonna be there for you.
Mm-hmm. That's good. Thank you guys so much. Is there anything, last tips that you want to add, or go in different direction?
No, I think we're good. Thank you for having us, Molly. And if anyone has any further questions, they can reach us at our emails, which are on the screen. And if you're only listening in, it's dbeck@thenationalalliance.org and salongo@thenationalalliance.org. And we answer emails frequently.
Yeah, and can you guys give out the telephone number too?
Yeah, so it's 202-223-1500. Now, it's important to know just one last thing. You know, we don't do any direct services. We're kind of a resource center. So if you are a parent and you call up and you say, you know, my Dr. Smith doesn't do this or doesn't do that, you know, we can't really give you any direct services, but we're happy to give you resources. We're happy to give you tools. We're happy to give you the things that can empower you to go find the answers yourself. But we just have to put out, no direct services.
I guess I should ask you all, because one of the questions I get a lot is, does anybody know an adult doctor that deals with, you know, youth with autism getting to be older, or an adult doctor that, deals with behavior health with, chronic illnesses or something. Do you all have like references to physicians, or do you send people to certain sites to look for physicians?
It's kind of a multi-pronged attack sometimes to find good doctors and providers. We encourage people to ask their current providers if they have any recommendations, to ask other friends, family members who are similarly situated. A lot of times it's a word of mouth thing. Unfortunately, there's no master list of providers who accept, but based on insurance, reach out to your insurers. And
I know that's a struggle, and something that we are trying to do is when we do incorporate these pilot projects in different systems, we try to have the pediatric practice create an adult provider list that have providers that are accepting young adults, new patients, ready and at hand, and that's like part of something that we're trying to implement more.
So it doesn't hurt to just always ask, do you have a list somewhere, or do you have any suggestions? Because the provider, the nurse practitioner, whoever it may be, might have some guidance for you.
So I guess it's also good. The advice we're going to say again is start early, parents. Early and often.
Young adults, they're excited about a lot, and you need to get them excited about their health early and often.
Terrific. Thank you all so much. For those of you listening, this is just one of a series of webcasts and webinars that we've had that are located on the AJE website. That's www.aje-dc.org. And we have all kinds of special education and disability ones, and we actually are building up our pieces around healthcare and medical issues, and very much thanks to you all. Thanks, Dan and Samita. I appreciate it.
Thank you, Molly.
Thank you so much.
This is great.